My name's Hannah. I'm a third year medical student, and today I'm going to be speaking to you guys about post traumatic stress disorder or PTSD. So, oftentimes we think of PTSD just affecting combat veterans or those who have experienced war. But in reality, PTSD can occur in all people of any ethnicity, nationality, or culture and at any age. PTSD affects approximately 3.5% of US adults, and every year, an estimated 1 in 11 people will be diagnosed with PTSD in their lifetime. Women are twice as likely as men to have PTSD, and three ethnic groups, US Latinos, African Americans, and American Indians, are disproportionately affected and have higher rates of PTSD than non Latino whites. So, what exactly is PTSD? Well, it's a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, a terrorist act, war or combat, rape, or those who have been threatened with death, sexual violence, or serious injury. So, people with PTSD have intense and disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They may relive the event through flashbacks or oftentimes nightmares. They may feel sadness, fear, or anger, and they may feel detached or estranged from other people. People with PTSD may avoid situations or people that remind them of the traumatic event, and they may have strong negative reactions to something as ordinary as a loud noise or an accidental touch. So, a diagnosis of PTSD requires exposure to an upsetting traumatic event. However, this exposure could be indirect rather than firsthand. For example, PTSD could occur in an individual learning about the violent death of a close family member or friend. It can also occur as a result of repeated exposure to horrible details of trauma. For an example, this could occur in police officers that are exposed to details of child abuse cases. So, the symptoms of PTSD can be divided into four major categories. These include intrusion, avoidance, alterations in cognition or your mood, and also alterations in arousal and reactivity. So, examples of intrusion symptoms would be intrusive thoughts, such as repeated involuntary memories, distressing dreams, flashbacks to the traumatic event. These flashbacks may be so vivid that people feel like they are reliving the traumatic experience or seeing it before their eyes. So, symptoms of avoidance. This includes avoiding reminders of the traumatic event, like avoiding people, places, activities, objects, and situations that may trigger these distressing memories. People may try to avoid remembering or thinking about the traumatic event, and they also may resist talking about what happened or how they feel about it. So, alterations in your mood. So, this includes inability to remember important aspects of the traumatic event, negative thoughts and feelings leading to ongoing distorted beliefs about oneself or others. For example, thinking that you're bad or that no one can be trusted. Distorted thoughts about the case or consequences of the event, leading to wrongly blaming yourself or others. Ongoing fear, horror, anger, guilt, or shame, and less interest in activities that you previously enjoyed. So, alterations in arousal or reactivity. So, this involves arousal and reactive symptoms that may include being irritable or having angry outbursts, behaving recklessly or in a self destructive way, being overly watchful of one's surroundings in a suspecting way, or being easily startled. Also includes having problems concentrating or sleeping. So, for a person to be diagnosed with PTSD, symptoms must last for more than a month and must cause significant distress or problems in the individual's daily functioning. Many individuals will develop symptoms within 3 months of the trauma, but sometimes symptoms may appear later and often persist for months and sometimes years. PTSD often occurs with other related problems such as depression, substance abuse, memory problems, and other physical and mental health problems. So, some related disorders to PTSD include acute stress disorder. So, this also occurs in reaction to a traumatic event, just as PTSD does, and the symptoms are very similar. However, the symptoms occur between 3 days and 1 month after the event, which is less time than PTSD. Remember that PTSD symptoms must last for more than a month. People with acute stress disorder, they also may relive the trauma. They have flashbacks or nightmares and may feel numb or detached from themselves. About half of the people with acute stress disorder go on to also have PTSD. And it's an estimated 13 to 21% of survivors of car accidents actually do develop acute stress disorder. And between 20 and 50% of survivors of assault, rape, or mass shootings also develop this disorder. Another disorder related to PTSD is adjustment disorder. This occurs in response to a stressful life event or multiple events. The emotional or behavioral symptoms a person experiences in response to the stressor are generally more severe or more intense than what would be expected for the type of event that occurred. Symptoms of adjustment disorder include feeling tense, sad, or hopeless, withdrawing from other people, acting defiantly or showing impulsive behavior, or physical manifestations like tremors, palpitations, and headaches. Symptoms of adjustment disorder will begin within 3 months of a stressful event and last no longer than 6 months after the stressor. So, how do you treat PTSD? Well, it's important to note that not everyone who experiences trauma develops PTSD, and not everyone who develops PTSD requires treatment. For some people, symptoms of PTSD subside or they disappear over time. Others get better with the help of their support system, like family, friends, or the church. Many people with PTSD, they do need professional treatment to recover from this distress, and it can be intense and disabling. It is important to remember that trauma can lead to severe distress. That distress is not the individual's fault, and PTSD is treatable. The earlier a person gets treatment, the better chance of recovery from PTSD. So both two treatments that are used in PTSD includes talk therapy, which is where you go and see a therapist and they talk to you, and also medications. One category of talk therapy is called cognitive behavior therapy, or CBT, and it is proven to be very effective. So different types of CBT is called one type of CBT is called cognitive processing therapy, and this focuses on modifying painful negative emotions such as shame and guilt, and beliefs such as like I have failed, or the world is dangerous, or this is my fault due to this trauma they experienced. So therapists will help people with PTSD confront these negative emotions and memories. Another type of cognitive behavioral therapy is prolonged exposure therapy, and this uses repeated detailed imagining of the trauma or progressive exposure to the symptoms like triggers in a safe and controlled way to help the person face and gain control of their fear and distress and learn how to cope. For example, virtual reality programs have been used to help war veterans with PTSD re-experience the battlefield in a controlled therapeutic way, and this does help treat their PTSD. So some examples of medications that are used to treat PTSD, these are usually antidepressants. They're called SSRIs and SNRIs. These are commonly used to treat the core symptoms of PTSD, and they can be used either by themselves or in combination with that talk therapy that I mentioned earlier. Another example of a medication that can be used is called prazosin, and this is often used for nightmares. And then one important thing of note is that people with PTSD generally should avoid using melatonin, which is commonly used to help us go to sleep. I use it myself, but in PTSD, it can actually make vivid dreaming and nightmares worse. So it's important if you have PTSD to try to avoid melatonin if you can. That was pretty much everything that I had to say about PTSD. So if you have any further questions and think that you might have this disorder and would like to get screened and seek help, you can call into our phone line and ask some higher level people that are not med students questions about this, and they'll be sure to help you out. Thank you so much.